Unique traits in newborns. Spitting up. Babies spit up a lot, and it's usually no big deal. Their tiny tummies are still learning how to work. The stomach is small and lies flat. The entrance is loose, the exit is tight. So milk sometimes comes back up instead of going down. How to help? Change diapers before feeding, not after. Hold baby upright and burp gently after feeding. If baby pees or poops right after eating, wait a bit before changing. If breastfeeding, pinch the areola to slow fast milk flow. Make sure baby latches onto the whole areola, not just the nipple. Fill bottle nipples fully to avoid air bubbles. Spitting up is normal and usually fades as baby grows. No need for meds, just gentle care. Oral bumps and funny mouth shapes. Ever notice tiny white bumps in your baby's mouth? They are called oral pearls, totally harmless, and will go away on their own. Other harmless quirks. Horse teeth, little white dots on the gums. Mantis mouth, chubby cheek pads. No need to touch or treat, just let them be. Breast swelling and inverted nipples. Both boys and girls can have swollen breasts a few days after birth. It's from mom's hormones and might even cause a little milk discharge. Important. Don't squeeze or press, it can cause infection. Inverted nipples in baby girls are normal. No need to fix or fuss. Jaundice, yellow tint. Many babies turn a bit yellow around day 3. It's called physiological jaundice and happens because their liver's still maturing. Shows up around 72 hours. Common in 50% of full-term and 80% of preemies. Clears up in 7 to 10 days. Usually no treatment needed, just keep an eye on it. Early weight loss. It's normal for babies to lose a little weight in the first few days. Why? They sleep a lot. Sucking reflex is still weak. Milk intake is low. They lose water through skin and breathing. They pee and poop often. Don't worry, weight gain kicks in soon after. Peeling skin. Around 2 weeks old, your baby might start peeling. It's just old skin shedding and the waxy birth coating coming off. No lotion needed, this is totally normal. Hair loss. Some babies lose hair after birth. It might thin out or fall off completely. It's normal and usually grows back. No one knows exactly why, it just happens. Crying. Crying is how babies talk. Loud, rhythmic cries, often without tears. Happens 4 to 5 times a day, up to 2 hours total. Doesn't mess with sleep or feeding. Let them cry, it's healthy communication. Smiling. Newborns smile in their sleep, and it's not random. It often means they are comfy and content. More smiles equals baby feels good. Fewer smiles equals baby might be uncomfortable. Watch those expressions, they are clues to how your baby's feeling. Cone head. Babies born vaginally might have a pointy or swollen head from squeezing through the birth canal. It's called cone head and goes away in a few days. Just make sure it's not cephalohematoma, which may need a doctor's look. Irregular breathing. Newborns breathe fast, about 40 to 50 times a minute. It can be uneven, especially during sleep. That's normal for their developing nervous system. Trembling. Little shakes in the jaw or limbs. Not seizures, just immature nerves reacting to touch or sound. Totally normal. Funny faces. Babies make all kinds of expressions, frowns, grimaces, air sucking, nose wrinkling. It's part of their development. If one face keeps repeating nonstop, check with your doctor. Stretching and straining. Babies often turn red and stretch when waking up. It looks intense, but it's just like us stretching after sleep. No need to stop it or rush to the ER. Startle reflex. Sudden flinches or cries from loud sounds or movement. That's the startle reflex. Swaddling helps, but don't wrap too tight. Candle wrapping can slow development. Hiccups. Hiccups are common after fast or messy feeding. One trick: gently flick the baby's foot to make them cry a little. It opens the lungs and often stops the hiccups. Skin rashes. Red patches on the face or body. They are common in the first few days and usually vanish within a week. No treatment needed. Sneezing and stuffy nose. Newborns sneeze a lot. It's a reflex to clear their tiny nasal passages. Doesn't mean they are sick. Learn to gently clean their nose if needed. Sweating. Babies sweat easily, especially on the head, hands, and feet. Their body's still learning to regulate temperature. Keep the room comfy and baby hydrated. Thin hair and bald spots. Hair texture depends on mom's nutrition during pregnancy. Later, genes take over. Bald spots on the back of the head aren't always calcium related. They can come from hard pillows, iron deficiency, or other nutrition issues.